Hello, I'm Dr. Juan Salazar, Physician-in-Chief at Connecticut Children's. I'm here to answer some of your questions related to COVID-19. Is the COVID-19 vaccine safe? The vaccine is very safe. In fact, I've had 2 doses of the vaccine. I've had very little side effects, a little bit of soreness in my arm, but nothing else. And that's in line with what we have seen through the clinical trials. A very safe and effective vaccine is one that I really highly recommend for you to get. Is the COVID-19 vaccine effective? These 2 vaccines, the one from Moderna and the one for Pfizer-BioNTech, are incredibly effective. The clinical trials showed that they're 95% effective preventing COVID-19 disease. This is better than I've seen for any other vaccine in the past. So absolutely, these are very highly effective vaccines. I've heard some people had allergic reactions to the COVID-19 vaccine after they received the vaccine. How common is it? It is true. We have seen through the clinical trials, both from Moderna and Pfizer, that some people will have an allergic reaction to the vaccine. And also post-licensing or post-emergency authorization, both in the United Kingdom and here in the US, there have been reports of individuals who have an allergic reaction to the vaccine. Fortunately, all have been treated appropriately and they've recovered nicely. Of course, if you have a reaction like this, you will not get a second dose. So it can happen. It's still a rare event. We don't know exactly how common it is. It is rare. It's not a reason not to get the vaccine at this point. What are the most common side effects of the vaccine? Having received the vaccine, the most common side effect is soreness in your arm. It is injected into your muscle in your deltoid, and I can tell you that within 12 hours, 24 hours, you'll have some soreness. You probably will not going to be doing some kickboxing or whatever you normally do for about a day. A little bit of Advil, ibuprofen usually helps, and you'll recover. That is the most common side effect. Some people also experience a little bit of headache, a little bit of malaise, a little bit of tiredness. It goes away within 24 hours, and I can tell you personally that that's what happened to me. Just a little soreness, nothing else. Is one type of vaccine better than the other? Both vaccines are very similar. They're made up the same way, maybe slight differences in the mRNA composition, but other than that, it's really an exact same product. So there's no reason to choose Moderna over Pfizer. Whatever you get is what you need to get. Can I mix the different types of vaccines? For example, if I get a Pfizer vaccine for my first dose, is it okay to get the Moderna for the second dose? It is not recommended. The CDC recommends that you get the first dose and the second dose from the same product. Do I need to receive both doses of the vaccine from the same clinic location? You potentially could get it from a different location, but the current recommendations from the Centers for Disease Control and the Connecticut Department of Public Health is that you go back to the same site where you received the first one. What do we know about the COVID-19 vaccine supply right now? There's plenty of vaccine. My understanding is there are about 30 million dosages available right now in the US. So the supply is there. The difficulty we've had throughout the country, fortunately not here at Connecticut Children's, is that there's not enough vaccine that has been delivered for it to be administered on a timely basis. That will change, I think, over the next few weeks as it begins to be delivered throughout the country. Multiple strains of the COVID-19 virus are now circulating globally. Are the COVID-19 vaccines effective against these 2? As far as we know, both Moderna and Pfizer-BioNTech are very effective against all the strains that are currently circulating, including the variant that has recently been reported. What if a significant portion of the US population doesn't receive the vaccine? Will we ever reach herd immunity? I think we need to reach about 70% protective immunity to develop herd immunity. If it's only 10, 20, 30%, this will continue to circulate. So it is really, really important that over the next 6 to 8 months that at least 70 to 80% of the population get vaccinated. And my hope is that for Connecticut Children's, we get 100%. Can I stop wearing a mask and PPE after I receive the vaccine? Not at this point. There's enough virus that's circulating, and we don't know enough yet about shedding of virus, even if you've been vaccinated, for you to not wear a mask. So please continue to wear your mask. Social distancing, everything we have in place does not change right now. I'm considering waiting to receive the COVID-19 vaccine. Can Connecticut Children's reserve my doses for later? Unfortunately, we can't do that. We have to get everyone vaccinated. We've sent out an email to everyone, so please register. We do have a window, probably the next 4 to 6 weeks to be able to get you registered, give you the vaccine here. You may be able to register elsewhere, but if we wait too long, if you wait into March or April, we may not have vaccine for you through Connecticut Children's. So please go ahead, take advantage of this. This is a really great opportunity for you.